Hey, LinkedIn, and welcome back to Business Unusual. This is a live show brought to you by the LinkedIn News team where we're talking as a community about the changing nature of work. I'm Caroline Fairchild, editor-at-large here at LinkedIn. It's Wednesday, September 16th, and here's a quick look at the top stories that are trending right now on LinkedIn. The decision by JP Morgan Chase to return workers in Manhattan back to the office caught many by surprise, but it wasn't without reason. Worker productivity was declining, according to a report by Bloomberg. Output was suffering at the biggest U.S. bank, especially on Mondays and Fridays. But less than a week that workers returned to the office, they were forced to return back home as one of the bankers did get the virus. And as the pandemic continues, we're seeing a boom in freelance work. That's according to Upwork. More than one-third of American workers, that's 59 million people, took on some freelance work this year. That's a 22% increase from last year. But as the gig economy is booming, we're seeing women getting fewer and fewer roles, both full-time and part-time, according to LinkedIn data. Globally, around the world, female hires was down about 40.2% in April. Those numbers rebounded slightly in June and July, but women continue to take on an outside portion of both childcare and household responsibilities throughout the pandemic, which could have a lasting impact on their careers. For more stories like these, be sure to check out Working Together. That's my weekly newsletter on the changing face of U.S. business. There is no industry that is feeling the impact of COVID-19 more than the healthcare industry, where doctors, nurses, healthcare providers are having to come up with solutions in real time. And that includes the hiring process. Joining us now is Dr. Iman Abuzeid. She is the founder and CEO of Incredible Health, a hiring platform for nurses. Iman, welcome to the show.
Thank you for having me.
Okay, so the hiring process for nurses, I've learned, it takes a long time to hire a specialized nurse. It can take up to 90 days. You figured out a way to bring that down to 12. How have you done that?
Yes, Incredible Health, we're the fastest growing career marketplace for healthcare workers in the country. And how we've done that is through software and technology, right? So on our platform, the employers apply to the nurses instead of the other way around. We've automated the pre-vetting and screening of the nurses. We've also enabled custom matching algorithms. So when a recruiter, say at Cedars-Sinai Medical Center, logs in, like they don't want to see 200 nurses, they want to see 11 that are the exact right fit for them. And that's what our custom matching algorithms enable.
You mentioned using software and technology for the hiring process. This is something that most industries have done by now. Why is healthcare so behind, and how are you making it so that the process is faster and they're keeping up with demand right now, particularly during the pandemic?
Absolutely. So the process, you're right, the processes and tools that hospitals and health systems have used to hire really haven't changed since the early 90s. You know, post a job, hope something happens. And given the high volume of hiring that they have to do, as well as the high priority, it's really time for a much more updated, much more modern process and technology to support them. And that's exactly what Incredible Health does for them.
So what are hospitals doing to adapt right now as you think about the demand for nurses, how many have to be in there, particularly during the pandemic? What are you hearing from them in terms of what they need from you right now?
Right. So even before the pandemic, we were in one of the biggest labor shortages or labor crises like of our times. Healthcare is the biggest labor sector in the entire country by number of workers, but our demand for healthcare as a country keeps going up, but we don't have enough workers in the system. And so the pandemic and COVID-19 exacerbated this. We're going to be 1 million nurses short by 2024, and the pandemic has made it even worse. So one of the things that we've just recently launched formally is an extended platform to better serve our hospitals and nurses during COVID-19. Hospitals have been hit hard financially due to the pandemic, and they are continuing to be understaffed. And so we support them with hiring permanent specialized nurses in less than 12 days. And we've done that by adding a lot of remote hiring features like remote interview scheduling, remote interviews, and enhancing our custom matching algorithms as well to meet their needs during the pandemic.
Nursing is predominantly a female profession, and we just discussed at the top of the show that women hiring is suffering during this pandemic. What are nurses telling you about what they're doing right now? Are they scared going to work? What are you hearing?
So what we're hearing from nurses is it's pretty consistent across the board. I am overworked because my unit's usually understaffed. I'm being asked to work overtime constantly. I am burnt out and I'm stressed out. The pandemic has exacerbated all of these issues. So one of some of the top things hospitals are doing to address this is to, of course, hire more permanent nurses, as well as just allow for more flexible scheduling as well. So they're better able to handle their work-life balance. That's just one of many, many things hospitals are implementing to support their workers.
I'm going to go ahead and say hello to some members who are joining us in the stream right now. Justin from Oregon, Michael from Michigan, Diana from Colorado, Andrea from Florida, and Greg from New York. Thanks for joining us. Cynthia said it will take everyone working together to get through this. So Cynthia, thank you for that. Dr. Iman, I wanted to get your perspective on just the pandemic overall and how it's going to impact healthcare. What are you seeing, and how do you think that this pandemic is going to impact care overall in the long term?
So in the short term, it looks like patient volumes are coming back, and hospitals, patients, nurses, they've all just have to become accustomed to what's going on right now, and just roll with it. In terms of the more long term, I think there's some things that are fundamentally changed, like the adoption of technology in this industry. We're very much in the nursing and HR world, and we're seeing rapid adoption of software and technology because they're being asked to do more with less. It's just become, a requirement. You can't interview everyone in person. You got to interview remotely now. So we're seeing this rapid adoption of software and technology in order to improve operational processes like hiring and many others.
You mentioned the rapid adoption of technology, but I'm curious, where are the pain points? Who's resisting any sort of technology adoption right now that's making it less rapid?
Look, healthcare, it's an old school industry, right? Many people are stuck in their ways, but we work with many leaders that are early adopters and pushing for these changes in order just to improve the operations. At the end of the day, hospitals run on very thin margins. They are businesses at the end of the day, and they have to care about their bottom line. And so cost savings using platforms like Incredible Health and other types of software is going to be critical and strategic for them going forward.
You mentioned this nursing shortage, which was an issue pre-pandemic and now is even exacerbated throughout this crisis. Are you seeing workers from other industries come into nursing, or where and when are we going to meet this demand?
Yeah, unfortunately not yet. You're right. The underlying supply of nurses is just simply too low. And we're not seeing enough people enter the profession. One of the things that we've done is we provide free to every single nurse in the country, so they never have to pay for it out of pocket. It's required to maintain and renew their licenses, and now they can access it completely for free on Incredible Health. And so we're going to need more initiatives like this to make it cheaper to train nurses and to educate nurses, so it continues to become a more attractive profession.
Well, Dr. Abuzeid, thank you so much for joining us on Business Unusual, and thank you for your leadership in this space right now.
Thank you so much for having me.
That was Dr. Iman Abuzeid talking to us about Incredible Health, how she's getting nurses and other healthcare professionals into jobs faster, something that's increasingly important during this pandemic. Thanks for joining us on the show. And as this unrest and dangerous time continues, employers are having to think more robustly about the benefits that they are providing to employees. One of those is fertility coverage. I want to bring in Tammy Sun. She's the CEO of Carrot, a company that offers global fertility solutions for employers. Tammy, welcome to the show.
Hi, thanks for having me. It's good to be here.
So Tammy, we spoke, I think, last year about Carrot, and you were experiencing a lot of growth. Growth continues throughout this pandemic by more than a third. Talk to us about what you're seeing and why Carrot is booming so much right now.
Well, this has been a difficult time for everyone, but I think one of the things that has become clear at the employer level and with benefits is that fertility is a core part of healthcare. Employers are adopting these benefits very rapidly, primarily because employees want them. The pandemic and COVID hasn't stopped the ways that people pursue parenthood. And so whether it's from the very earliest moment of thinking about how you're going to pursue parenthood and manage your fertility health, all the way through fertility preservation and for women egg freezing, through IVF, adoption, and surrogacy, this is a fundamental part of healthcare. I was talking to a friend of mine, Jake Anderson over at Fertility IQ, and he said that content on the Fertility IQ website for egg freezing during COVID has grown more than 230% in terms of user engagement. So this continues to be something that people care a lot about and workers expect when they go to work.
So it's clear that demand is increasing, but I have to assume that during the pandemic, a lot of clinics had to close down. So how did you keep up with demand, and how did Carrot adapt?
Yeah, we saw, a huge shift in obviously access from the clinic perspective, as you mentioned, clinics in the U.S., but not just the U.S., but also around the world where we operate shut down for, different periods of time. So our focus was immediately on supporting members, making sure that they knew what their access was, when clinics were coming back online, when they would be able to go back, and also what are the new protocols that are required when you go back. A lot of clinics now have temperature checks and other screenings that have to be done before they walk into the clinic. But other ways that we've really pivoted to develop a product roadmap that meets this moment is we began to really focus on things that would double down on telehealth and remote access and virtual access. So, for example, we launched a virtual pharmacy, Carrot RX. And this allows people who are going through treatment to order their medications online without having to go pick it up. We also launched Carrot at Home, which is a suite of products. And our first is a timed intercourse product with Ava that allows people to begin their fertility journey at home so that they don't have to start with IVF as the starting line. We also launched Carrot Pregnancy, which is virtual access to midwives and doulas. So we really started to reorganize our product roadmap and think about what are the things that our members need in this particular moment. But to your question, there was a ton of activity around the world with regards to access being, access to clinics being open, access being shut down. And so our priority was really tracking all of that data and making sure it got into the hands of our customers and our members.
We know from LinkedIn data that telehealth is one of the biggest growing skills, as well as job postings that we're seeing on the platform right now. And speaking of job postings, Carrot is hiring right now. What are you looking for? Tell our viewers a little bit about the type of talent that you're seeking. I think we may have lost Tammy. She's frozen just a little bit.
You cut out for a second there, Carolyn. Can you repeat that?
Oh, of course. Yeah. I was just saying that as you're hiring, tell our viewers a little bit about what you're looking for.
Yeah, so we are hiring across the organization. More than half of my time now is spent recruiting and meeting and talking to different candidates. And so everything from sales to engineering to care navigation to customer success, we're hiring across the org. But the most important thing is that we want folks who are passionate, smart, values aligned, and dedicated to our mission, which is fertility care for all. And what that means is fertility care for all people, regardless of age, sex, sexual orientation, gender identity, race, or marital status.
And as demand for fertility benefits increases in the workplace, it's kind of changing the way that we talk about this at work, talking about it more openly. What does this increase in demand and also increase in chatter around fertility benefits tell us about how our relationship with work is changing?
Yeah, it's a great point. I was talking to a customer of ours, and she said, she's an HR leader, and she said that, ever since they implemented Carrot as a fertility benefit, she's noticed that the conversations around fertility at work are much more open. People will talk about what they are looking at in terms of treatments, the things that they're going through. And I think having your employer offer this as a standard work benefit along with medical, dental, vision does a lot to destigmatize the conversation around fertility, which has for many decades been something that has not only been considered a luxury consumer good, but not really appropriate for work or polite society and polite conversations. So I think we're seeing a real renaissance and a real sort of shift in how people engage with this topic. And I think a big part of that is because all people are sort of realizing that this is a core part of healthcare.
Absolutely. And as we're getting more comfortable talking about this core part of healthcare, some employees still may be uncomfortable bringing this up with their manager. What's your advice for them?
Yeah, and if you do still feel uncomfortable, that is totally fair. I think some of the tactics that we have seen work well at work with people and members is oftentimes employees will look to employee resource groups, so ERGs. We've had requests come in to Carrot through ERGs. So if there's a women women ERG, if there's an LGBTQ ERG, that can be a great resource for you. The other thing is really to sort of buddy up. So if there's somebody at work that you feel comfortable sort of teaming up with and going to talk to HR about this need, we've seen that be successful as well. And then the third thing is really sort of speaking up, not just for yourself, but perhaps on behalf of somebody else at work. So you may be somebody who doesn't need access to fertility benefits and probably won't use them, but you may have a friend at work or a colleague at work who you know could really benefit from this, but they are not comfortable speaking up on behalf of themselves. We've seen some real success in sort of, speaking up for folks at work.
And if you're just joining the stream, I'm seeing a lot of new members joining us. This is Business Unusual, a live show where we are talking about the changing nature of work. I'm here with Tammy Sun. She is the CEO of Carrot. It's a fertility benefits platform. And we're talking about just the increase in demand right now for fertility benefits during the pandemic. I'm going to say hello to some members in the stream. Dawn, Randy, Diana, thank you for joining us. Tammy, you mentioned ERG groups and leveraging them for Carrot. How is Carrot addressing racial disparities right now in terms of access to healthcare and benefits like fertility?
Yeah, this is really important. As I mentioned before, our mission is fertility care for all. And in the wake of the murder of George Floyd, we took a really hard, long look at the company and our product roadmap. And we realized that while we were, built on and had done a lot of good work around inclusion, we were not doing enough, and everybody can do more. And so we recently launched a new feature that allows BIPOC members to connect with a BIPOC provider, so Black, Indigenous, person of color provider. And this is really, really important because we know that being able to connect with a provider of the same race or the same culture leads to better health outcomes. We know that there are health disparities here. And so when members are using the product, when members are using Carrot for their fertility benefit and their fertility coverage, they can connect with their care team, and their care team can match them with a BIPOC provider in their area.
And we saw at the top of the show that this pandemic is impacting female workers in particular. You are a venture-backed female founder, which is unfortunately still a rarity in Silicon Valley and beyond. Talk to us a little bit about what you think needs to change to get more funding in the hands of women and people of color right now.
Oh, there's so much. I mean, I think, one of the things that I'm really heartened by is more and more female venture partners at firms. And so I think the work that Allraise is doing and some of the work that I'm seeing some of the individual folks doing is really fantastic. So, a lot of the conversations that I have, some of the best conversations that I've had about the opportunity and the size of the market and the size of the opportunity when it comes to fertility has really been with female partners at these venture firms. But this is an absolute. I think the latest stat, Carolyn, that you mentioned, if I remember correctly, it was like less than 3% of all venture dollars last year went to female founders. And so it's a hard problem. I don't have the answer. I'm sorry.
It's a hard problem, but it's one we should continue to discuss. Tammy, it's always great sitting down with you. Thank you for joining us on Business Unusual. Gifty in the stream says this is an amazing conversation that is overdue. So we thank you for your time. Thank you.
Thanks for having me. Thanks so much. Talk to you soon.
That was Tammy Sun. She's the CEO of Carrot, talking to us about booming demand right now for fertility benefits during this crisis. I want to thank her for joining us on today's show. This is Business Unusual, a live show coming to you from the LinkedIn news page every day at 12 Eastern. Tomorrow, my colleague Susie Jackson will be back for you with a show that you are not going to want to miss. I'm certainly not going to miss it. She's going to be talking tips and tricks to stay healthy and happy as we enter the fall season, with a special appearance by a chef who'll teach you how to whip up something good for your body and your taste buds. Be sure to join us tomorrow from the LinkedIn news page at 12 Eastern for that show. I'm Caroline Fairchild. Thank you so much for joining us.